Myself, Dr. JIBRAN Ahmed presents to you Simply Pathology, and today we are back with a very special session. So as you have already seen the thumbnail stands for Jago, that means wake up. Now this is a wake-up call for all the residents who are enrolled in the MD DNB Pathology course. This is a very important session, and this session has been placed on request of all the residents who are actually sending me lots of messages lately saying that, sir, we have access to all the materials and everything, but yet we are not able to concentrate in our studies and we are losing track. Okay, before I start this particular series, remember one thing, that motivation often comes after starting and not before. So if you have to complete your task, you have to start doing the task in order to complete it. If you just sit back and contemplate that everything is going to fall in place by itself, no, it will not happen like that. Okay, so please pay a lot of attention. Today's session is very important one. Okay, so let us begin. So what is the biggest reason for the loss of track? Okay, what is the reason, okay, why you are not able to concentrate or complete your task? Okay, what is the main reason for that? Okay, so the major reason for this mainly is procrastination. I hope that many of you know what is the meaning of procrastination, and for those who do not know, procrastination means it is an act of delaying or putting off task until the last minute past their deadline. Okay, so whenever you are just you are just thinking, today I will read, okay, today I will read this topic, okay, when I will, okay, today I did not get time, okay, then tomorrow maybe in the first hour I will do that. Now by the time tomorrow you want to read that, again something came up, okay, and as a result you are not being able to fulfill your duties. So as a result, what is happening, that your work is pending. So suppose you decided that today I am going to read chapter 1 general pathology. Okay, maybe you started one chapter, okay, maybe you read one page of it, and then you said, okay, I will read again, I will read in the evening, oh, I will complete it by tomorrow. So what is happening, you are not giving a lot of time, something other comes in your mind, okay, or you take your phone or you do something, but you do not complete that particular task. Okay, so that is basically what is procrastination. It is an act of delaying or putting off task until last minute or past their deadline. That is procrastination. आज करेंगे कि कल करेंगे कि परसों करेंगे, इस तरह से बोलते हैं procrastination. So this is very important. So now you have to understand one important thing, that why this procrastination thing happens. What is the most important reason that you are falling back? Okay, the most important reason over here is that you are unorganized. Okay, you are completely unorganized. The thing is, you have to be organized in order to address all the duties that is basically ascribed to you. So in order to complete all the tasks, you have to be quite organized. And why do you have to be organized? You have to be organized because the brain loves organization, and I can prove it. Okay, I can prove it how. Now all of you must be listening to music, and you must be having your own playlist of songs. Okay, and inside the playlist of songs you are having all the different songs. For example, song number 1, song number 2, 3, 4, 5, like this you are having one by one in a particular order. The songs have been arranged. Now once you listen to this particular playlist 1 time, 2 time, 3 time, 4 times, so multiple times you are listening this particular playlist. So once this song number 2 is ending, automatically your brain is going to know which is the next song that is now going to play. So you will be exactly able to say that now this particular song is going to play. Okay, so how is this possible? Because the brain has a memory, and that memory remembers the things when they are in the organized manner. Similarly, if you play randomly any songs, okay, you choose and you play any song, any minute, in that case the brain is not going to decipher, or the brain is not going to understand what is the next song that your mind is going to play. So brain loves organization. So whenever you organize or you schedule your task throughout the day, or one day prior, you make a plan that I will do this in this particular order, and this is the exact amount of time that should be required for this particular chapter of this particular work. In that situation, your mind becomes completely in control of the task and it acts accordingly. Okay, so when the mind is prepared, then the body is going to act accordingly. So this is the first and most important thing to deal with procrastination. You have to get organized. Okay, now the thing is, how is it that you will get organized? How to organize your brain? How to organize your entire body? This is the question. So the most important question is that to get organized, the mind should know the goal. The mind should have a particular direction. Yes. Now, very importantly, there are two particular videos which are already available in the YouTube. I am going to put the link of both these videos in the description box of this particular video. The first video, if you remember, it is with regards to the MD, DNB, okay, curriculum. Okay, MD, DNB curriculum. Very, very important. And the second video, if you see, is the part 2 gold medal. Okay, is another video, how to clinch the gold medal during your exams. Okay, so these two videos are already available in the YouTube, so you can go through these videos. Okay, one another thing is, how is it that the mind should know the goal? Now remember, all of you are residents, right? You are residents. So unless and until you go through this curriculum video, you will not understand what is it that is required out of the pathology residents in this 3 years. So what is it that you have to do? You have to see these videos to get a grasp and hold. And the second and the most important thing that you have to know is to arrange the last 5 to 7 years question paper of your respective university. Why it is important to look at the question paper? I am repeating once again. It is not only that you have to take the Xerox of the question paper and you keep it in your cupboard. No, you have to take the questions and you have to go through the questions. Only when you go through the questions, you will come across certain questions that you don't know about or you have heard for the very first time. And you will see that certain questions are getting repeated again. So that question becomes important, right? So if you do not see, or if you go through the question paper regularly, your mind is going to search for answers to that particular question. If you just keep the question papers aside in one corner, your mind is never going to understand and never going to work. How I can tell the difference? See, there are certain residents who are actively following whatever guidelines we have given, and only those residents I see, they are coming up that, sir, where is this particular answer, where I can find this particular question's answer, what to write over here, what to write over there. Why they are asking? Because they have come across the questions. So once they have come across the questions, the mind is asking the question to them. Okay, so this particular question is very common in the exam and I have to find the answers to this. So the mind is acting in that particular way, and we are always open 24/7. Just you give us a WhatsApp and we are answering to all the enrolled members in Simply Pathology app, right? So this is how you have to take the first step. The mind has to know what it is working for or what is the aim. So the aim is to know the curriculum. The aim is how to go about the residency, which is discussed in the gold medal video. Okay, you have to go through, and the third and most important thing is to go through the question paper. Now over here at this point, I would like to share a very, very important incident with you, which happened with me just 2 days back. So one recently joined first year resident. Okay, the resident is from West Bengal. Okay. Now that resident has seen all this video, he has seen the curriculum video, he has seen the gold medal video, he has seen everything, right? And after that, he went and, very nicely, he went to his senior in his college and he asked that please give me, you must be having all the question papers. Can you give me the question papers? I want to go through the question papers and the list of questions. Now, do you know what that senior replied to that particular first year? The senior replied, okay, the senior replied that you are in the first year, okay, right now it's the time for you to enjoy, okay, it's not during the exam time. Why do you need the question paper? And the first year resident, he tried a lot in different ways to get the question paper, but then he could not. The senior denied, and in the end he could not get. Okay, ultimately that first year resident, he came to us and we provided all the question papers of West Bengal for the last 5 to 7 years. So what I am trying to make you understand is that only you have to care about yourself, not your seniors, not your professors, not anyone is going to help you out during the exams or anything. This is a very professional world, and I am not mincing my words. I am being very, very clear. Okay, I am being very, very clear with what the practical scenario is. So you have to work for yourself. So what is the source of questions? Either you have to ask your seniors, or very commonly, okay, you should visit your own health university website. For example, for us there is WBUHS. For example, Rajiv Gandhi University of Health Science. This is for Karnataka. So sometimes all the question papers are uploaded in the respective health site or the website, or you can visit the college library. Most of the time, 90% of the time, you can get the question paper from the college library. So the first important thing, if you have not done till now, you have to arrange the question paper. And even if you have arranged the question paper, if you have not gone through it, please go through the questions, because unless and until you go through the questions, you will not get an idea that what is it that is important practically for a pathologist. Okay, because only the practically important questions, okay, they are basically they are coming year after year in the exams. So you have to know the question paper and the questions which are asked in the last 7 to 8 years. Okay. So this is a very important incident that I have shared with you. So just to highlight to you that you only are responsible for your residency. You cannot depend on the seniors, juniors, or on the professors that they are going to take care, or you cannot put butter on them and they will take care during the exams. If you don't answer any question, everyone is going to just say that what you were doing for the 3 years, and they will completely change during the exams. So remember, it is your responsibility and it is your duty to get acquainted with all the questions. Once the questions are here in the brain, once these questions are there in your brain, only then, only and only in this particular situation, your mind will act on it. The later you start, the later your mind will act, and the more chances are there that you are going to panic. Okay, I have seen a lot of residents who are actually coming to us in the 3rd year, okay, and they are panicking. So if you are in the 1st year or in the 2nd year, and if you have joined us in the Simply Pathology, you have access to everything. Okay, so make the best use out of it. Okay, also in the end of this lecture, I am going to teach you and I am going to show you how to take the maximum advantage of our website as well. Okay. So remember one thing, okay, till you don't pass your exams, that means you don't have an MD degree. So you will not have a job, you will not have any financial income, and not only that, you will not be able to sit for any exams. Okay, or even if you sit, you will not be eligible because you don't have an MD degree, right? MD or DNB, whatever degree, and you will not be able to sit for the super specialty exams as well, or any other exams. If you want to switch over to any other thing, or you want to sit for any other exam, or you want to change careers or anything, so for that particular 5 to 6 months of time is just waste. So remember this thing, that till you don't pass your exams, you will not get an MD degree. I am not making you afraid, but remember, approximately 98% of the MD residents and around 90 to 95% of the DNB residents, okay, they are passing every year. Still, this number is huge. Okay, so remember this point. It is easy to pass, it is not very difficult, but remember one thing, that if you fail, then you don't have an MD degree, you don't have a job. I think this is a very, very important motivation for you to get back on track. Okay, so this is very, very important. Don't take it easy, don't take it very lightly. So always remember, this is the graph where I am showing the procrastination. Okay, so on the y-axis I have taken the pain, and on the x-axis I have taken the time. So remember, the more you are going to procrastinate, okay, the level of pain is going to increase. And how this guilt or this irritation is going to go? The irritation is only going to go when you start the work. Okay, once you start doing all the work, with time the pain or the worry or everything is going to come down. Okay, so the problem is not doing the work, it is actually starting the work. You keep on contemplating. One of the residents has just joined, and I see that he is just procrastinating. Okay, every week he will call me and he will say that, sir, this has happened, that has happened, this has happened, and sir, now I am ready. From now on, I am going to read very nicely, I am going to do this. Again, the same thing is repeating the next week. That means in this whole week, he has not done anything. So that means the only way to break this cycle of procrastination, that means आज करेंगे, कल करेंगे, वो दिन देख लेंगे, जब एग्जाम आएगा तो देखेंगे. This thing, if you want to break into this thing, you have to start the work. If you don't start, if you don't take action, you will not do anything. So the most important thing, the most important lesson is, the first thing you wake up, you take action. You take responsibility of yourself. Okay? Okay. So how to bring about discipline in the day-to-day life. So I am going to now discuss the various things that you have to do and how you should do, and all these points will be discussed in a very practical way. You will find all this knowledge everywhere, okay, but I am going to give you a very, very practical solution to what you can do. So the number one thing, as I've already discussed previously also, and I am repeating this, at the end of each day, you should write down the most important things that you need to accomplish tomorrow, and you should put forward realistic goals. Now, having said this, it doesn't mean that you will take a pen, paper and you will write. No, doesn't need. If you just think in your brain, okay, tomorrow first thing I have to do this, then I have to do this, then I have to do this, then I have to do this. So for example, I will take my, just take my example. Yesterday I was making, I was researching the different things that needs to be done. So my first thing was that tomorrow first thing in the morning, that is now, today I will record my session. Then after that I have some other work that I have to go to the for the voter ID registration I have to go. So that work is there in my mind. Then the third thing that I want to do today, when I want to come back, then I have to complete my certain projects with relation to the organisms. Okay, I am right now making a video on the organism. I have to do that. Then in the evening hours I have to also go to a doctor's appointment. Then I have different things which I have already set apart in my mind. I have thought about that yesterday. So today morning when I woke up, so basically I did not have to ponder around what I will do, what I should do, what I shouldn't do. My mind already knows that today I have to wake up, I have to do this work. So my body and my mind, it started acting out. Okay, it is starting acting completely in the morning in the way that I want to, towards my goal. And very importantly, you have to give realistic goals. What do you mean by realistic goals? So for example, you want to complete one chapter. And if that chapter is very small, for example, there are 8 pages or 9 pages of that chapter and that is it. So you can give, tomorrow morning, first hour, 2.5 hours, I am going to give a first very fast reading of this 8-page chapter. That is a realistic goal. Now, for example, if you say that, okay, tomorrow I'm going to study very nicely. In the morning, I'm going to complete neoplasia. In the evening, I will come back from college. I will complete the chapter on immunity. That is the general pathology. I will complete everything. So this is a unrealistic goal. I know neoplasia is very difficult. Even if you read very, very fast and if you read very dedicatedly also, neoplasia alone is going to take more than approximately 7-8 days time, and immunity will take around 15 days time to complete. It is as big, so these topics are very big. So you have to write down very realistic goals. That is very important. And when I am talking about task over here, it does not mean only your departmental task. Departmental task means your study task, okay, or if there is any seminar you want to prepare for that, or you want to act for your thesis. These are all your departmental tasks, right? Not only that, in day-to-day life, you also have certain other tasks. For example, you might be the only person who has to go to the bazaar to do the shopping for your home. That is also one of the tasks that you have to accomplish. Maybe you have to take your parent to a doctor's visit. Even that is a particular task. For some time, you have to carry out certain bank work. That is also one of the tasks. So you cannot just shove away, or you just cannot, cannot just black out all the other things apart from your departmental tasks. And then what happens when you do not incorporate your day-to-day life things with your departmental tasks, when you do not coordinate between them, then only major problem arises. So what happens is suddenly you will remember, okay, today I have to go to the bazaar, I have to buy this stuff. Then you will go over there and you will come back, you will say, I could not read because I had to go there. No, the problem is you did not allocate a particular time for that particular work. So it is very important, whenever you are planning your day one day before, you also have to plan out that, okay, tomorrow if I am going to the university, maybe I have to buy one book, or from there I will go to the doctor's appointment, or from there I have to go to some, or maybe there is a get together with friends, so I will go. So accordingly, if you know that there is a get together, there is a plan, beforehand, you have to plan accordingly one day before. So if you, for example, you have a lot of, obligations for a particular day, and in that day you are also setting up a lot of departmental goals that I have to complete this, then you are not going to complete those tasks. And as a result, you will feel irritated, you will feel disgusted, and you will have a lot of guilt at the end of the day that I was not able to do. It is not your fault that you were not able to do. It is your fault that you were not able to plan realistically one day before. So what does a realistic plan looks like? So for example, chapter number 1. Okay, I will complete at least 30% of this chapter number 1 today. Along with that, okay, I am going to just complete, for example, I am going to read the topic of normal hematopoiesis from Simply Pathology app. Hematopoiesis I am going to see. Okay, then for example, I am going to just read about one clinical pathology topic. For example, I will read about the lab diagnosis of malaria. Okay, so this much if you complete in one day, this is a realistic departmental goal, or this is a realistic goal for your residency life. Okay, understand? So what is very important, this must be looking like it is very less, but you have to do this task consistently over a period of time to see good amount of results. Okay. So this is the first thing that you have to do to bring discipline in your life, that you have to organize your day one day prior. If you can write it down. Now everyone has their own, they have their own thing. Some people, they want to write it down. Some people can do. For example, I just do it in my brain. I just make it sure that I will do this thing in this day. So this is the thing that you can do. The first thing is to get organized, is to prepare a list of things, and you should prepare a list of realistic things that you have to address. Second thing is to prioritize those tasks in order of their true importance. Now, for example, first thing in the morning when your mind is fresh, so you have to, put your mind and heart and soul into reading, because first thing in the morning when the mind is very fresh, reading is very nice. Now, for example, if first thing in the morning, okay, you prioritize that, okay, I will go to the bazaar and I will do the shopping first thing in the morning. Then when I come back in the evening, I am going to work. Now, whatever your mind was very fresh in the morning. So some things you can cover very nicely in a less period of time in the morning as compared to the evening after you come back from the department. So prioritize the task in order of the true importance. This again becomes very important. Third thing is, when you arrive tomorrow, means now today is the day you should do the task. You should concentrate only on the first task first, and you should complete the first task. Now, if I have to complete 30% of this, then I will make sure that I complete 30% of this task very honestly. Okay, work until the first task is finished before moving on to the second task. Now, for example, first thing in the morning, you were not able to complete 30%. Maybe you completed 20% of this chapter number 1. So when you came back in the evening, don't leave this and go on to this topic. No. You complete the remaining 10%, and after that you go on to the next topic. Now, for example, till end of the day, maybe some emergency came or some other work came up, and as a result you are not able to complete lab diagnosis of malaria. So you did not read that. You put it for the next day. Okay, you put this lab diagnosis of malaria first thing in the morning for the next day. Okay, but you do not leave any task unfinished. This is what my message is. And always remember, you should take baby steps. Rome was not built in a day. Now, for example, today also I will show you a particular routine that you have to follow religiously. Okay, and how you can follow a particular routine religiously. Okay, and how you can apply to your day-to-day life. Now, it is not like that today you have seen this video, today you are charged up, then tomorrow first thing in the morning you can follow everything. No, once by once. Okay, maybe you start with one subject, maybe you start with 1 hour per day. Okay, so but at least you have to start. If you don't start, you are never going to reach, and there is no good time. The good time is now only. So you have to start taking baby steps, one step at a time you have to take, and you will see in no time you are reading 3 to 4 hours a day very easily, effortlessly. This is the term I am saying, effortlessly you are able to read everything. Now, the most important or the worst enemy, okay, in today's era, the worst enemy is the social media, especially the reels that you watch. You know what happens? Very importantly, for example, you are reading something and you have kept your phone nearby. You take your phone like this and then you just start seeing one thing. You open Instagram, you saw that one of your friend has put something very nice. Then you went into one reel. Okay, some reel is going on, one Pathan, Jawan, then animal has come in. Okay, then you see that someone is doing some funny video, then you will see one baby video, so you see your mind, your brain completely lost track of everything, and by the time you come back to your work, already 1 hour is gone, or maybe half an hour gone, or maybe 20-30 minutes is gone completely. And after that, your mind has also completely lost track of what you were doing. See, your mind was reading, then social media is something completely different. Your mind went in this direction. It completely changed the direction. Now, it will also take some time for the mind to come back to the original plan that you were doing. To come back to the reading, it will take some time, right? So, this is very, very important that you have to eliminate distraction. So, how you can do that? See, it is very difficult for me also. And what I have done, I am sharing with you. So when I am working, okay, and for me my phone is very important because a multiple number of students are having some or the other doubts which I have to clear them. And as a as in Simply Pathology, I believe that we are providing 24/7 service to all the residents, and for us the residents is the main priority. But even after that, I also have to have time to make videos. I also have to have time to do the research on the new updates, and all these things are time consuming. So I have to be away from my phone, from my social media also. So what I do, that whenever I am working, okay, I make 45 minutes cycle. Okay, if you are comfortable making 1 hour cycle, you can make 1 hour cycle. If you can stay away from your phone for 1.5 hours, then you can make cycle. For me, I cannot stay away from my phone more than 45 minutes. For that 45 minutes, I put my phone in the airplane mode and I am just doing my work. Believe me, the amount of work I am getting done in 45 minutes, it's a lot of work that I get done. So what I do, for this 45 minutes, I completely, put my phone in the airplane mode. And after 45 minutes, I try to give some award to myself. For example, award may be that I will check social media, I will see some reels, okay, and I will see, for example, 10 minutes time I'm going to use with my phone. Okay, not only this, whenever I am giving certain target to myself, for example, today I have to do this work I have to do. Then end of the day, for example, I like playing games. And any person can like you, some person can like watching movies. So I like to play games, okay. Or for example, I like to play the first shooter game. So at the end of the day, if I complete all of my tasks by 8 o'clock or 8:30 tomorrow, then 1 hour I keep aside for gaming. Okay, so that is my award. I am awarding myself with little pleasure. Or for example, you can award yourself. For example, if I do this, then today I will order pizza and I will have pizza. Or for example, so very little pleasures. Okay, not always, but most of the times, if you give yourself, or for example, today if I do this, I will watch this particular nice series. Okay, so it is not that you should 100% only work. No, you have to work, and along with that, you have to make yourself happy also. So if you award yourself with little pleasures, you promise yourself that I'm not going to use the phone in this particular time. Okay, so you have to be very, very mindful. I'm not kidding. On an average, every particular person is wasting or investing 2 to 3 hours of their time every day in the phone. The other day, I went to the police station. Okay, I went to the police station. Basically, I had lost one driver's license. So I went, it was a long time back. So I was seeing that in the police station, all the police, they are sitting over there and everyone is in their phone. Even in the road, the puchka sellers, okay, they are also in their phone. When they are not doing any work, they are in their phone. Everyone is basically engrossed in the phone. If you go throughout the shops also, many shops in your area, if you go, all people, they are in their phone, they are watching some or the other thing they are doing. So a lot of time is being wasted on the social media. Remember one thing, and reels are one of the worst things. It is more addictive even as compared to cigarette and alcohol. Even you don't spend that much time drinking or smoking as compared to the amount of time you're spending watching reels. So you have to eliminate distraction. This is one very, very important task that you have to perform. Now, some of you have also requested that, sir, how to deal with the departmental politics. Politics meaning, you can see this is one person over here, okay, maybe this is you, okay, and maybe this is your friend. And you can see the friend, although he is putting his hand behind you, but also he is holding one particular knife. At the moment he he stabs you in the back. Or for example, you see two people, okay, who are facing each other or greeting each other very nicely in a smiling way. Okay, but back of that, they are very angry with each other. Usually, if you see many professors, and teachers, actually faculty members, okay, they have this kind of behavior with each other. They are very happy in front of the other teacher, but when they are going to other room, then they start saying something at their back. So this is very common. This is very common, and it is not only in the government places, it is there even in the private places as well. Okay, so this is not something which is new. Departmental politics is very much, it was there previously, it is there now, and it will remain there till the end of this era. Okay. So departmental politics is very common. That is always be there. So the thing is, what you have to do, you have to be very diplomatic. Okay, you should not be in anyone's side. You should be very diplomatic in your approach. Okay, this is very, very important. You have to work in a way that you get the maximum knowledge out of it, and you should not come in the eyes of the head of department or in the eyes of any professor or any high authority person. So the quieter you are, the better it is for you. This is very, very important. And always remember one thing. I always believe in one thing. Okay, so people, you know, they have, differentiated human beings on the basis of race, caste, religion. So there are Hindus, there are Muslims, there are Christians, there are Bengalis, even, there are people from Delhi, they are Delhiites, okay, Biharis are different, then Bengalis are different. So according to the states, they have divided people as well. But remember, these divisions are created by human beings. Naturally, only two types of people are there. One is the good type of person, one is the bad type of person. And always remember that in this world, although there is a lot of bad and our mind tries to concentrate on the bad, but remember there is some amount of good as well. And because that good is there, that this world is also existing. So have faith in the good. What I mean to say that in your department where you are, it cannot be that 100% of the teachers or 100% of your batchmates or 100% of your seniors, they are bad. There will be some seniors who are very good. There will be some teachers who are also very good and they are kind-hearted and they will help you. So always remember one thing, that you should concentrate on the good in your life and not in the bad. And please remember one thing, that scolding, shouting, screaming, okay, from the professors, this is a part and parcel of residency. Please remember this, this is a part and parcel of residency. You need to have a very thick skin. Okay, so if the teacher, if the professor is saying something bad to you, just remember that they do not have any other entertainment in their life than to, inflict some pain on you. You can say that some of them, they are sadist. Some of them, not all of them, but some of them, they are sadist, and this is the culture in our country. And I think in many other countries it might be, but more in our country, I think this culture is there. So you should not take anything to your heart. The moment you start taking everything in your heart, you are going to disturb your work, you are going to disturb your personal life, you are going to disturb everything around you, and the people around you also will be disturbed by you. So it is very important, leave everything, whatever you leave at your workplace, leave at your workplace. When you are at a home, it is your time. You should not bring your work life in your personal life. Okay, this is very important. When you come back home, it is the time for you to rejuvenate. It is not a time to think what happened in the college. This person said, that person said. And remember, okay, putting butter, okay, on any faculty will not serve you any purpose. In the exam, remember, the outside examiner will come, two of them will come, only the HOD and some, professors will be there. So putting butter on anyone is not going to solve any purpose. If you are wrong, you will be wrong. If you don't answer your question, you are not going to pass. Remember this simple fact. Okay. Now, whatever steps that I have discussed right now, okay, all these steps, if you carry out for just one day, you are not going to see results. You have to carry them consistently over a period of time. Now, I am not telling you that, every day you will be able to do everything. Some days you might not be able to. This is life. Life is not a straight line. Life is always a graph. Some days are good, some days are bites, some days are slow, some days are big. So life is always going as a graph like this. Okay, this is what life is, right? So you should always remember that there will be good days and there will be bad days. So it depends on how, if you fall down one day, okay, life is all about getting up and getting back on track. So always remember these few points that I have discussed with you in details. Okay, now I am going to discuss again, okay, how to make a routine during your residency and how to follow that routine religiously. So in a usual day, okay, in your usual day, basically what you have to do from the morning, I am a morning person, starting from morning to the night. Now, this is working best for me and I am just sharing my experience with you. Some people, they prefer reading in the night and I'm all right with it. The only thing that I'm worried about that you have to cover at least, these subjects every day. So first of all, HS basically stands for heavy subject. And what all subjects come under the heavy subject section? General pathology, systemic pathology and molecular pathology. All these three, they come under heavy subject. Then we also have something called as the light subject. Light subjects mean hematology, it means clinical pathology, cytopathology and gross. Okay, these are all lighter subjects. And then there are certain miscellaneous subjects like autopsy, recent advance, histotechniques or even articles. Certain articles, okay, these are very, very these are actually, this is how I divide all the subjects. Now, why it is important for you to divide these subjects? Because you have to work according to the subject that you are reading. So first thing in the morning, straight away from when you wake up in the morning, for example, you woke up at 6 o'clock. From 6 o'clock to 8 o'clock, 2 to 2.5 hours you have to dedicate towards a heavy subject. Now, for example, on day 1, the heavy subject was general pathology. On day number 2, you go to systemic pathology. On day number 3, you come back to general pathology. Understand? So in this way you can, so Monday, Tuesday, Wednesday, one day general path, systemic path, one day molecular pathology. Again you repeat the same, again general path, systemic path, molecular pathology throughout the week. Understand? So after that you have to get ready, then you have to reach your work at around 9 o'clock. So I believe that in most universities, okay, it is from 9 to 5 that you have to stay. Residency is like a job, is like job hours, okay. So I believe that you are spending a lot of time in your university, okay, but I also believe that you can take out some amount of time during the hours when you are working in the college. So at least 1 to 1.5 hours you can take out, okay, and in this time you can read the miscellaneous topics. So everyone, I believe they are getting 1 hour break time, okay, during your residency period, 1.5 hour easily. It is not like that all the time you have work. Usually in the first hour till 1 o'clock, 1:30 you have a lot of work, but usually between 2 to 3 or between 3 to 4 you have a lot, between 2:30 to 3:30 you have some amount of time left. In that time you should read mainly the recent advances, the autopsy, the histotechniques, all these things you have to read in details, okay. And when you come back after 5 o'clock, okay, then for example 1.5 hours you have to give to the light subject like either hematology or clinical pathology or cytopathology or to the grossing. So in this way if you read, then you are covering each and every topic. And I also suggest that you always should mix and match everything that you are reading, because in this way you are not bound to get bored. If you only read general pathology the whole day, your efficiency is going to come down because you will get very bored out of it. Okay, but if you divide and if you cover so many things together in a particular day, little thing, then your mind will be very happy that you were able to cover so many different things throughout the day. Now, not only this is a generalized routine. Sometimes you have to prepare for a seminar. Sometimes you have to prepare for a spotting test. Sometimes you have to prepare for a journal club or any departmental extra co-curricular activity is there. In that situation, you can always omit the light subject, and after you come back, that time you devote for your seminar, spotting and your journal club. Okay, this is how your routine is. Along with this routine, I always say that if you do not sleep for 8 hours a day, you will not be able to concentrate very well throughout the day. So a continuous sleep for 8 hours is very important for having a fruitful day. Okay, always remember this point, that continuous sleep is very important for your health. Not only that, if every day you get around 30 minutes of time for exercise or just going out for walking or a stroll, it is going to have tremendous health benefits, not only your physical health but also your mental health. So 30 minutes of time if you can take out, not if it might not be possible every day, but at least 3 out of 7 days or 4 out of 7 days or alternate day, if you can go out for a walk, it is very important. So if you work like this, then I feel by 7:30 every day you will have a lot of time yet remaining, okay, for other activities like your enjoying time or your going out time or many other activities you can do over here. Understand? Then around 10 o'clock you should sleep and you should wake up around 6 in the morning, taking 8 hours of good sleep. Always it might not be possible. Sometimes you have a child to take care of. Sometimes all these things might not fall in place. But you should try to achieve this kind of routine. Okay, the timing, it is just according to my my preference. It might vary with you, but you have to give at least 3 to 4 hours every day, okay, during your residency if you want to pass. Okay, now with passing, I will tell you one important thing. The next important thing I will tell you. Now with passing, I will tell you, you have only got 3 years of time to read. Okay, you trust me, you don't get the time once you enter into practical life or once you start your practice life. After passing, you don't get time to read. So the amount of reading that you can achieve in these 3 years of residency, you cannot achieve the same amount of reading after you pass, because after you pass, most of you are married in that time, you have children or you have parents to take care of. You have to earn money for your livelihood, and all of your mind, you will see your counterparts, they are joining 1000 labs, you want to join 1000 labs too. He is making that much amount of money, I also want to make that much amount of money. So your growth stops. You only want to go and you want to earn money and you become busy. So you don't have time to think, you don't have time to read, you don't have time to upgrade yourself. So that is why I always tell you, start from the first year itself. And remember, first year, it is the only time where you will get the maximum time to read, in the first year. If you have wasted the first year, you have wasted a lot of time. It is not like you cannot achieve all the good things. You can achieve, but you have to work doubly hard. You have to put in more amount of effort. If you are following this particular way of reading and doing everything from the very first, you will never have a problem any single day throughout the residency. Okay, I always say this. And one more thing I want to tell everyone, that always remember, okay, that it is all right when you enter into residency. There are lots of things that you will not understand, lots of things will not make sense, and lots of things, it will feel like giving up, very easily every time. But remember one thing, everything will fall in place. You just have to give it a little bit of time and you have to continue your reading part. Okay, so till you do not do that, you are not going to, you are not going to have a comfortable journey. This is what I want to tell you. So this session was mainly about how to get back on track. And remember, the biggest motivator is, as I told you, if you don't pass, you don't have your degree, you cannot earn, you cannot give your any other exam. And remember one thing, you are your best friend only, not your senior, not your junior, not anyone in your home, not your family, not your professors, faculty, teachers. Okay, they are not going to spoon feed you. Your family can just give you support. It is you who has to read, who has to get everything done. And in the end, it is you who have to answer the examiner. So it is you who have to read. Okay. So previously everything was so difficult. Okay. You had to read so many big books and everything. But if you see today, we are having our own website and app. Our own Simply Pathology app is there. So I am going to show you today how you can make best use of the Simply Pathology app. I will show you the different aspects that we are having and how to make best use of it to get the most out of your residency. So stay tuned. So as you can see over here, this is the interface of our website. Okay, even in the application, you will have this kind of interface. So over here, this is the interface of one of the students. So this is the My Enrollment section. So over here, as you can scroll down, you can see this Postgraduate MD DNB Pathology 2023 bundle. Okay. Around 12 courses are there in this particular bundle. If you are going to go in this particular bundle, if you see, so very importantly, you can see that there are list of different courses. So everything has been made for the residents. Okay, so easy it has been made. So for example, a first year resident, he wants to start his studies. So over here, he can see that there are multiple sessions. For example, for the basic histology, epithelium, glands, for muscles and nerve. For female genital tract, basic histology is there. For ovary, basic physiology, histology is there. So different sections have been created for learning. Similarly, if you see, this is the clinical pathology along with the molecular pathology, as you can appreciate over here. So you can see that there are around 22 lessons for the urine pathology is there. Urine clinical pathology, 3 parts are there. Basics of peripheral blood smear is there. Okay, then the molecular part like flow cytometry, polymerase chain reaction, cytogenetics including the fish is there, automated hematology analyzers are there, then molecular diagnostic sequencing study, that is the NGS, then the quality control is there, then all the different parts like the semen analysis is there, malaria is there, CSF examination is there. So many different topics have already been covered over here. That is not only going to help you pass but also help you in the practical life. Okay. Then for example, you are having general pathology, okay, wherein there are basically 7 chapters over here. You can see 1, 2, 3, 4, 5, 6, 7, and then there are other topics also over here. And not only that, right now we are also incorporating the NEET super specialty videos as well, along with the general pathology videos. Okay. So basically all these things have been incorporated into this particular course. Now if you see over here, in addition, just like the general pathology, we are having cytopathology, we are having hematology, we are having systemic pathology part 1, part 2. Okay, then you are having, very importantly, the histotechniques and the staining. No course is providing you so much detailed topics. So you have separate lessons for the histotechniques, wherein starting from the fixatives through the tissue processing, theory of staining, automation, IHC, everything is discussed over here in the histotechniques. Then you can also go in the grossing part. You have grossings of different organs like the breast, colon, rectum, FGT, stomach, pancreas, kidney, testis, prostate, appendix, gallbladder. So all these grossing videos are also available very freely over here in our website. Okay, so you have to just enroll, you have to just start your day. You can just enroll these videos and you can start watching. This is going to immensely benefit you. And the most important thing that I want to highlight in today's topic of discussion is to show you some hidden gem available in our website. You can see that there is a section on the exam slides. So there are list of cytology slides, there's a list of female genital tract, soft tissue, bone, skin, histopathology, testis, and we are always updating this particular, as and when we are getting the cases, we are going to update everything in our website. If you see over here under this cytology section, for example, this is the giant cell tumor. So you can see this is a giant cell tumor. Now you can go through 4 important slides, 1, 2, 3, 4. 4 such slides are there. If you come down over here in the about section, if you type, then you are getting this particular case, giant cell tumor with the case history, 37-year-old female with swelling in the little finger around 1.5 centimeter, firm swelling. So also the particular description of the particular slide is also given, which you will not get anywhere. So GM sustained smears are moderately cellular, comprising of both stromal and osteoclastic giant cells. Stromal cells are round to oval with nuclei and scant amount of cytoplasm. No atypical features of mitosis are noted. Impression tenosynovial giant cell tumor. Okay, so very importantly for every particular tumor, for example, over here if you see the Rosai-Dorfman disease, okay, if you see these particular slides, okay, so again this is slide number 1, 2, 3, 4. Again over here in this particular 12-year-old boy, 5 centimeter swelling in the neck. So also you are getting the case history, okay, in which age group you are watching this. And you are getting, the entire slide description as well very nicely. So you just have to go over there and you have to see everything has been made ready for you for your practice. Again, not only this, for every particular slide, you will see that there is a discussion section also wherein you can write your own description. For example, I will show you in this giant cell tumor only. If I go into the discussion section and if I see view all the discussion, you can see that different students have basically given their own description over here. So they have described these slides very nicely over here. You can go through the description and you can learn how to write down the descriptions very nicely. Okay, so this is about the exam slide section, and this is one of the most dreaded section in the exam. So you have access to everything, how to write the description, what are the different exam slides, the important exam slide that you have to, see for your exam. And during the exam times, if you just go through these exam slides and the slide description, your work is done. It is that much easy. Okay, apart from that, we are also having a very important downloadable resources. So under the downloadable resources, you can see the recent advances resources, histopathology exam notes, cytology notes, autopsy notes. Okay, all these extra exam notes are already uploaded in the website. For example, for the recent advance. Okay, so for example, in the recent advances, you can see the recent the RA notes part 1. So if you go into the attachments, you can see the list of topics. Like approach to mediastinal tumor, you can directly download. Acute lung injury, you can again download. Braphomas, again important example. Just download the notes and read it. Okay, so these are Big Bang theory of colorectal carcinoma. You can directly download. These are all very important recent advanced questions. For example, RA notes part 2. So why the part 1, part 2 is being done? Because at a time you cannot give more than 10 attachments. Okay, so you can directly download all these particular notes. For example, matrix metalloproteases, liquid biopsy, okay, PMCT and its application, regenerative and neoplastic hepatocellular node. These are all your recent advanced questions which have been, the notes of which has already been made. You just have to download these notes for your exams. Okay, similarly, RA notes part 3 is there. There are different attachments over here. Similarly, your RA hematology text, RA histopathology text, all the different important PDFs are also available for download from here. Okay. Now, not only that, the histopathology exam notes as part 1 to 3 is there. So if you click on the attachments, for example, liver biopsy, renal biopsy, neuroendocrine tumor, Paget's disease, role of IHC in soft tissue tumors, RPGN, SIDS, okay, hereditary RCC, GIST, all these important exam questions have been discussed and it is already there. For example, if you go through the cytology notes, okay, if you go to the attachments over here, for example, recently they have been asking a lot of questions about the proliferation markers, okay, all the different systems like the Milan, Bethesda, cell block, Yokohama reporting of breast, proliferation markers, again important exam question is there. So all these newly, for all the important questions, we are also making notes and we are uploading directly in the website. So downloadable resources are very important. If you go in the downloadable resources, a lot of notes, for example, the notes for the autopsies are also there. So the Heart Washington manual, autopsy pathology manual and atlas has already been uploaded, this book, and autopsy, very simplified 3-page note is there for autopsy if you don't have time to read. Okay, so all these things are just available at your fingertip. Okay, so it is very helpful. This is what I want to tell you. And apart from that, if I show you, we have also started 2 new sessions. One is the practical super specialty NEET SS session, which is under development and will take approximately next 6 to 8 months time to fully, update this section. In that case, this will be a separate course. And we have a practical Viva OSCE session also, wherein over here I am discussing. So if you further scroll down, you can also see a practical Viva OSCE session, wherein we are discussing all the important exam slides and what are the important Viva questions which is possibly asked in the exam. Okay, so right now this part is also under development and this is also very important from the exam point of view. Although all these questions have been discussed in details in the respective chapters, but over here you have a more direct approach wherein all the questions can be revised very easily during the exams. Okay. So with this, we are we are going to end today's topic of discussion, and I hope you have learned a lot of things from this particular session. Thank you very much for watching this particular video.